Okay, so I'm going over here and I'm looking at my patient's order. So my patient has a order for a Foley, so I can do that. And I'm checking the policy of my facility to know, make sure I know what I'm doing and what the rules are. So I've done all that, so I can go ahead and get all my supplies together for a Foley. So I've got the actual Foley kit. I have 2 pairs of gloves for the cleaning. I have my stat lock, but I'm using tape for this one. I have washcloths and whatnot to clean the peri area, and a water basin to be able to clean, to hold the water, obviously. And the soap is in the room already, so I can go ahead and go take this to my patient. So knock, knock, knock. Good afternoon. My name is Megan. I'm a first year nursing student here. I'll be inserting a Foley for you today. Is that okay with you? Have you ever had a Foley before? No? Okay. So basically it's just a catheter that's going to go inside your bladder. It's going to help drain that urine. Is that okay with you? All right, awesome. So I'm going to go ahead and get my stuff set up. So I'm going to perform hand hygiene. Okay, so hand hygiene. Can I have your name and date of birth for me? So Buddy, August 31st, 1930. Awesome. Do you have any allergies or anything? Do you have an allergy to morphine? Do you have like an iodine or a latex allergy that you know of? No? Okay, awesome. All right, so thank you very much for that information. So I'm going to help you get set up like which way I need you to be. So I'm going to go ahead and put a bath blanket over you. Okay, so I'm going to pull down your sheets. So the sheets are now down at the end of the bed, and I can go ahead and, can I raise your bath blanket up? Okay, awesome. Can I spread your legs apart for me? Can you help me spread them? Okay. Awesome. So thank you very much for that. So I'm going to go ahead and get my gloves and perform hand hygiene. So I'm performing hand hygiene. Okay. So I've got the water. The water is running with all. Okay. So I got the water in here. Got some soap right here. Now I can don my gloves. So before I begin anything, I'm just looking around. I don't see any redness or anything or any drainage present in the peri area. When was the last time you had you urinated? Don't remember? Okay. No problem. So I'm gonna go ahead and just fill your bladder. Okay. So it is distended, so it tells me it's full of urine. Let's see. I'm looking for any drainage or anything like that. I don't see anything. My patient is able to follow directions. They are bed rest, so that tells me we need a Foley. That's the reason behind that. So I can go ahead and start cleaning. So I'm going to go ahead and dip my washcloth, get nice and wet, and then put some soap on it. So I got some nice soapy. Alright, so I'm going to go ahead and spread it. Okay, so down to the anus and the vagina, to the other side. Okay, go down the middle again. I'm gonna clean this side again since I already touched it. Okay, so I'm putting it in my linen, which is behind me. Okay, so I'm gonna go ahead and rinse. Rinse 1. Okay. 2 down to the anus, and then 3 down, and then I can go ahead and wipe again down. Okay, dropping in to the linen, and I can go ahead and pat her dry. Then the last one. Okay. So she is nice and clean, so I can go ahead and drop that. I can remove my water basin, and I can remove my gloves. I can go ahead and perform hand hygiene. So I can go ahead and open my Foley kit. Get rid of this. And I can move this into a trash bag. Put it right here for right now. So I can go ahead and put this away from me. Didn't break any sterility there. Good. So I'm going to reach in with a corner. And I'm going to put the waxy side down. Okay, so it is down. All right, I can go ahead and reach in and get my sterile gloves. I'm going to go over here since there's no room over there. I'm still keeping an eye on my sterile field. Okay. Really struggling to get these gloves on. Alright, so my gloves are on. So I'm going to go back over here. So I never lost sight of my sterile field. So I can go ahead and put this in the trash. The finished treated drape. I don't need it. Okay, I haven't touched anything, so I can go ahead and reach in and grab the betadine. Move this aside. So I'm going to go ahead and open it and pour this all over the cotton balls. So I reach around. Okay, it made it in there sort of. I can clean it up later. So I can go ahead and I'm going to move this to the side. Still within that 1-inch border. Alright, so all that's done, I can go ahead and squirt the lubricant. Once I remove this, okay, so I can go ahead and remove that and put that in there. So I've got the lubricant in there. So I can go ahead and reach in there and grab that sterile water and go ahead and connect it to my tube inside. Okay, and I can also remove the blue catheter. I can put it actually in the lube as well. Making sure it stays in the box. Okay. It's in the box. Okay. I can go ahead and shove it in there. It has not touched the sterile field. Okay, so I can go ahead and put all this back in there and move over to my patient. So I can go ahead and just move this around. Okay. Wiping the side. Okay, so I put it in there. I can go ahead and grab another one. I'm doing the other side of the labia, going around. Okay, and then I can grab my last cotton ball and go straight in. Going around, it's in. Okay. So I can go ahead and remove that. I don't need that anymore. So I've not lost my part of it. So I put this all in the loop. Okay. So you can bear down, you're gonna feel some pressure, okay? So I'm going in 2 to 3 inches. I have urinary churn, so I can go in a little 1 to 2 more inches. Okay, so it's now in. I can let go and push this in. Okay, so I can go ahead and tug on it. It's not coming out, so I can go ahead and let go. All right, I'm gonna remove my gloves again. Put it in the trash can. I'm gonna go right behind you. Then put some hand sanitizer again. Okay. So I can go ahead and stat lock it. So I'm gonna tape it to my patient's leg. I'm giving some slack. I can go ahead and just put this bag below my patient. So I'm attaching it to a non-movable part of the bed. So it's all connected, it's below my patient's draining. So I can go ahead and perform hand hygiene again. I'm gonna don some gloves. If I didn't already say, my patient's working, the bed is up and the doors were all closed and the windows were closed as well. So they couldn't see in, and I gave my patient privacy and the bed was up to my level. So if I didn't say that, I can say it now. So I'm gonna go ahead and clean my patient up because I made quite a mess. So I can move all this stuff. So I'll go ahead and move this in a minute. But I'm gonna clean my patient up because they deserve it. So I have my water again. And I've got my 3 rags. So I can go ahead and dump it in the water and then soap on it and go ahead and clean around, clean it to that anus. Clean again. Alright, cleaning down the middle to one side and then cleaning the other side. So my patient doesn't have any eyes or anything like that on there. So I can go ahead and put this in the linen. So I can now wash that soap off. So I'm getting it nice and wet. Okay. So I'm gonna just wash that soap off. Wash into that anus, other labia, washing down the middle to the right side of the labia, or down the middle, and then to the other side as well, all the way down the anus. So done all that, so I can put that in the linen, and then I can go ahead and dry my patient. Alright, so I'm drying the right hand side. drying the left-hand side, drying the middle, and then drying the other side. Okay, so my patient is all dry down there. I can go ahead and remove this water bucket. I can also remove this. Yeah, I can remove this and put the sheets back up. And then I'm gonna go ahead and remove all my trash. I can remove my gloves. I can sanitize again. So now my patient's all covered up, they're comfortable. I can go ahead and document everything I did. So I can chart everything like the abdomen distension. They don't remember when they had their last urination. I can chart that I put the Foley in. I can chart how much drainage, how much urine I have collected in the tube and what color it is. And yeah, so I can chart all that, and the patient's reaction to that was good. So I've done all that. I can perform hand hygiene again after touching the computer. So thank you so much, Bunny, and yeah, so thank you, and here's your call if you need me. I'll be outside. All right, thank you very much.